Healthcare is the maintenance or improvement of health via the prevention, diagnosis, and treatment of disease, illness, injury, and other physical and mental impairments in human beings. Healthcare can contribute to a significant part of a country's economy. Healthcare facilities are largely owned and operated by private sector businesses. 58% of U.S. community hospitals are nonprofit, 21% are government owned, and 21% are for profit. According to the World Health Organization, total healthcare spending in the U.S. was 18% of its GDP, gross domestic product, in 2011, the highest in the world. In 2007, around 85% of Americans had some form of health insurance, despite being among the top world economic powers. The U.S. remains the sole industrialized nation in the world without universal health care coverage. Obamacare, also known as Patient Protection and Affordable Care Act. It is a United States federal statute enacted by the United States Congress and signed into law by President Barack Obama on March 23, 2010. It is a law that is enacted to ensure that all Americans have access to affordable health insurance. An average of 11.4 million people were expected to be in Obamacare policies during 2017. There were 10.4 million people enrolled in June of 2016. 2018 new customers made up 27% of the total enrollment, down from 31% last year. If you can afford health insurance but choose not to buy it, you may pay a fee called the Individual Share Responsibility Payment. The penalty rises yearly with inflation. For the 2017 plan year, the fee is calculated two different ways, as a percentage of your yearly household income and per person. You'll pay whichever is higher. The organization estimates that 3/4 of the American population will likely be overweight or obese by 2020. The latest figures from the CDC as of 2014 show that more than 1/3 of U.S. adults aged 20 and older and 17% of children and adolescents aged 2 to 19 were obese. Today, 7 in 10 Americans are obese or overweight, but only 36% think they have a weight problem. There are more obese U.S. adults than those who are just overweight. According to a study in the Journal of the American Medical Association in 2008, the obesity rate among adult Americans was estimated at 32.2% for men and 35.5% for women. An estimated 160 million Americans are either obese or overweight. Nearly 3/4 of American men and more than 60% of women are obese or overweight. 10 factors that are believed to cause weight gain, obesity, and metabolic disease are genetics, engineered hyperpalatable junk foods, food addiction, aggressive marketing, insulin, certain medications, leptin, food availability, sugar, and misinformation. Medicare is a national health insurance program administered by the U.S. federal government since 1966. It provides health insurance for Americans aged 65 and older who have worked and paid into the system through the payroll tax. It also provides insurance to younger people with some disability status as determined by the Social Security Administration, as well as people with end-stage renal disease and amyotrophic lateral sclerosis. In 2015, Medicare provided health insurance for over 55 million to 46 million people aged 65 and older, and 9 million younger people. 53 years ago, Congress created Medicare and Medicaid and remade American health care. The number of elderly citizens lacking access to hospitals and doctors plummeted. Hospitals, physicians, and state and local governments came to depend on this federal funding. When Medicare was first proposed in the late 1950s, national health insurance had been losing costs for decades. On January 5th, Mills told the White House that Medicare would be the first order of business. The chairman knew that even if he continued to oppose the bill, pro-Medicare Democrats would be able to pass it without him and without consulting him. Mills understood that his best option was to craft a Medicare proposal that would contain as much as possible and would allow him to take credit for a major legislative victory. Republicans too wanted to be a part of the debate and offered alternative proposals. Congressman Thomas Curtis of Missouri and A. Sidney Herlong, a Florida Democrat, proposed an expansion of CARE Mills that had the backing of the AMA. The ranking Republican on Ways and Means, John Barnes of Wisconsin, offered a more ambitious plan. Barnes, who shared Mills' fiscal conservatism but also believed in the importance of social policy, proposed a voluntary program that would cover the cost of physicians and older Americans. Those who elected to participate would contribute a monthly premium toward their care, while the federal government would finance the rest through general tax revenue.